Good morning, afternoon, or evening, everyone, depending on where you are and when you're watching. I'd like to start by thanking you for joining this session. I'm so happy that you're here. And today I will be discussing the important topic of clinical documentation improvement, commonly known as CDI. Of course, that's what we're talking about through the whole series. But this focus will be on understanding how CDI enhances patient care and outcomes, how it ensures accurate reimbursement and revenue integrity, and also how it facilitates compliance with regulatory requirements and quality initiatives. So my name is Tony Appleberg Parks. We've met before in previous lessons, but I'm happy to be here again and introduce myself once again. I'm a clinical documentation integrity specialist expert from the United States and also a health administrator, among a few other various healthcare titles. I've spent beyond the last 30 years in healthcare, learning most of those years, learning the clinical healthcare side, allied health, various, EMS, laboratory, outpatient, and the past probably nearly 10 years in medical revenue cycle, working in collections, coding, clinical documentation, auditing, the various areas of revenue cycle. And one thing I learned over the years was a passion for wanting to help providers, help physicians learn to document so that they are not getting dinged on quality reviews. They're getting paid appropriately, not getting underpaid or not getting fined or penalized for overcoding. That would be most likely more of a coding issue, because if the documentation is there, then it should be coded appropriately. But if the documentation is not there, obviously you're not going to get reimbursed as well as you should have. You're going to be underpaid. Why not get paid for what you do, right? You work hard. So again, along with patient care and outcomes, one of the main important items is to ensure accurate reimbursement and revenue integrity. Excuse me. I'm just going to take a little sip. Okay. Sorry, I have a little itch in my throat. Okay, so as we move through the slides, please feel free to jot down any questions you might have. And at the end of the presentation, I will give you the information on how to get those answered. So, let's begin with an introduction to CDI. Clinical documentation improvement is a crucial component in healthcare that supports a variety of essential functions, from patient care to financial management to regulatory compliance. And you'll see our agenda in the slide. So first, let's get that disclaimer out of the way. Please note that the information provided in this presentation is for educational purposes only and should not be considered as legal or financial advice. Always consult with a professional for specific guidance related to your organization. All content is proprietary and should not be used or reproduced without permission. So moving into an introduction to CDI, the definition, and why is it important? Clinical documentation improvement, or CDI, is a vital process in modern healthcare aimed at enhancing the accuracy and completeness of patient records. Accuracy is what it's all about. Accurate documentation is essential not only for delivering high-quality patient care, but also for ensuring proper reimbursement and maintaining compliance with healthcare regulations. Have you ever seen documentation that maybe didn't quite meet the standard of a regulatory environment? Or have you ever had a patient that you may have felt a little frustrated because you didn't have the information you needed from the previous physician, and the patient wasn't a good historian maybe, and you didn't have what you need to prevent redundancy or to not have to go far beyond what should have been necessary to provide the type of care or diagnostics to deliver high quality care. So accurate documentation is essential not only for delivering high quality patient care, but ensuring proper reimbursement and maintaining compliance with healthcare regulations. Have you ever been reimbursed at a rate that was lower than you thought it should have been? Perhaps it was a code issue, perhaps perhaps it was because the code that was applied may have been appropriate based on the documentation, but you know that you did more. You know that this patient had a higher level of severity, that you offered more care, but it wasn't documented. And so coders, they can't just guess. They can't just read your mind. It has to be in the documentation for them to capture that code. And if the appropriate documentation is not there to capture a higher level code, then they have to choose the lower level code. I'm trying to think of an example of that as we speak. I guess a good example would be diabetes. Diabetes I tend to use as an example a lot because it covers a lot of bases. If most patients have complications related to diabetes, and if you have a patient, for example, with diabetic retinopathy, but you failed to document the retinopathy, or maybe you documented some medication, but still didn't document the diagnosis, the coder can't guess that. And if it's not in the assessment and plan or somewhere in the current record so that the coder can see that it's a current condition, then they can't capture that. I don't remember the code now, E1140, I don't know. Anyway, they can't capture that code with the complication. They can only capture the basic E11.9 code, which is diabetes without complications. And that's going to reimburse at a lower rate. So that's really what it's all about. You just have to remember, depending on, even if your regulatory environment doesn't require you to document those diagnoses every year, every 6 months, every single visit, whatever, it's still not a bad idea. And in my opinion, there's nothing wrong with the cloning or copy paste as long as you go back and verify the information that you are moving forward. Verify that it is current. It is up to date, but it'll still save you a lot of time, and ultimately not only will you see better reimbursement, but you're going to provide better patient care and do better in quality measurements. Inaccurate or incomplete documentation can lead to numerous issues, including miscommunication among healthcare providers, denied claims, and it can even go as far as potential legal problems. And something I used to teach my EMT students, and it was taught to me that way, is that if you didn't document it, you didn't do it. And sure, we did it. We may have performed the procedure, provided the care, done the assessment, whatever it is. But if we didn't document it and it comes up in court, or it comes up in quality review or a medical review, anything, there's no evidence of it. So even though we did it, we may as well not have, because we're not going to get credit for that. And such is the case for you as well. Therefore, CDI plays a crucial role in the overall healthcare delivery system. By ensuring that patient records are thorough and precise, CDI helps healthcare providers deliver better care and make informed decisions. For instance, when a patient's medical history is accurately documented, it reduces the risk of medical errors and improves patient safety. A very basic, simple example of that, and something that I would like to think doesn't happen much nowadays, but we know many years ago that occasionally operations happened on the wrong side or the wrong surgery altogether. Patient goes in for gallbladder and gets appendix removed. I don't know how often that happens, but I have seen errors in right and left. I've seen failure to document previous amputations. I've seen very often failure to notate when a medication is discontinued. So you can imagine how all these things can put a patient at risk for medical errors. So isn't patient safety our first priority? So if for no other reason, I think that's reason enough alone to really come up with a system to document well. Additionally, detailed documentation facilitates continuity of care, as it allows different healthcare providers to understand the patient's history and treatment plan comprehensively. As you know, not all patients are good historians, and they're not going to tell you what treatments or what diagnoses they've had in the past, or even if they do, it might not be accurate. So I can imagine as a physician, it would be very frustrating to you to look at a record and not have that information. Enhancing patient care and outcomes. One of the primary reasons for implementing CDI programs is to enhance patient care and outcomes. Accurate and complete patient records are fundamental to effective clinical decision making. Would you agree? When healthcare providers have access to precise and comprehensive information about a patient's medical history, allergies, medications, and treatment plans, they can make better informed decisions, reducing the likelihood of medical errors. For example, clear documentation of a patient's allergies can prevent adverse drug reactions. Imagine an allergy that can cause an anaphylactic reaction not being documented. And this drug is given, this could be a life-threatening situation, right? Additionally, detailed records ensure that all healthcare providers involved in patients' care are well informed and coordinated, leading to improved patient outcomes. Consider a case where a patient with a complex medical history is admitted to the hospital. Accurate documentation of their past treatments and current medications ensures that the attending physicians can provide appropriate care without the risk of contraindications or redundant treatments. This not only enhances patient safety, but also improves the overall efficiency of the healthcare system. Have you ever had a patient where you wish you had more information from the previous physician? Was that frustrating for you? Do you feel it was dangerous to the patient or maybe causing some redundancy that wasn't necessary? This is especially risky with patients who are not good historians. Maybe they don't know what treatment they've received. Another critical aspect of CDI is ensuring accurate reimbursement and maintaining revenue integrity. Proper documentation is essential for healthcare providers to receive appropriate reimbursement from insurance companies and government programs. When clinical documentation accurately reflects the services provided, it helps prevent denied claims and financial losses. For instance, a detailed and accurate record of a surgical procedure ensures that all aspects of the care provided are documented and billed correctly, leading to accurate reimbursement and avoiding revenue loss. As we mentioned, CDI programs help healthcare organizations maximize their revenue and potential while maintaining compliance with billing and coding regulations. By ensuring that every service and procedure is accurately documented, healthcare providers can avoid underbilling or overbilling, both of which can lead to financial penalties or lost revenue. Furthermore, accurate documentation supports audits and reviews, making it easier for healthcare organizations to defend their billing practices and avoid costly disputes with payers. Okay, on this slide I'm going to talk about facilitating compliance with regulatory requirements and quality initiatives. And I do realize that your healthcare system is not the same as the healthcare system in the United States, and you have a different regulatory environment, regulatory requirements. However, even though I'm going to discuss value-based care a little bit, and a little bit about Medicare and Medicaid, those are government-run, government-sponsored programs, and so the government does regulate and oversee the reimbursement of those programs. So I think that we can safely assume that you're going to have a similar situation in the UAE. So compliance with regulatory requirements and quality initiatives is another crucial reason to implement CDI programs. Healthcare providers must adhere to various regulations and standards to avoid legal and financial penalties. CDI ensures that clinical documentation meets these standards, supporting compliance with coding guidelines, quality reporting, and value-based care programs. So, for example, accurate documentation of patient encounters and treatments is essential for participating in the U.S. value-based care initiatives and receiving incentive payments. Just as very careful documentation supports higher level E&M coding in a fee-for-service environment. So greater complexity equals a higher fee, right? How can you claim the code for a higher complexity if you haven't documented that? By addressing compliance issues through CDI, healthcare organizations can improve their regulatory standing and enhance their overall quality of care. quality measures sometimes supplement the payment as well. Consider the importance of accurate documentation in meeting requirements of programs like Medicare and Medicaid or your own government program. These programs often have strict documentation requirements, and failure to comply can result in denied claims and financial penalties. CDI helps healthcare providers stay compliant by ensuring that all patient interactions and treatments are thoroughly documented, supporting the accurate coding and billing of services, and also supporting accurate scoring and quality measures that may assist reimbursement, as I mentioned before. So, does that make sense? Okay, so just as a recap about what we've talked about in this lesson, implementing CDI programs is essential for enhancing patient care and outcomes, ensuring accurate reimbursement and revenue integrity, and facilitating compliance with regulatory requirements and quality initiatives. These improvements ultimately lead to better healthcare delivery and financial stability for healthcare organizations. By focusing on accurate and complete documentation, CDI helps healthcare providers deliver high-quality care, optimize their revenue, and maintain compliance with regulatory standards. The importance of CDI cannot be overstated, as it touches every aspect of the healthcare delivery process, from patient care to financial management and regulatory compliance. Okay, so now is the time that I'd like to take a moment to thank you for your attention and your presence, and welcome you to ask any questions, send any comments you may have. You can do so by responding in the chat or emailing me at the address provided on the slide, and I'm happy to help in any way I can. If I do not have the answer for you, I have a great network of CDI experts, and I will get you the answer. And I really welcome your questions and your ideas, because we may use ideas or questions that seem to be a trend or a common thread to create additional videos and trainings in the future and try to get those questions answered for everyone. If a couple of you have that question, there's probably a lot more of you that have it, right? So please don't hesitate to reach out. And also, I want to let you know, if you have questions about how to get started with a CDI program in your own practice or facility, you're welcome to reach out to Innovation Plus Consultancies, and they will be very happy to help you. And so once again, thank you so much for your attendance, and I hope you have a great day.